So my talk is on accuracy of femoral component external rotation with all Burr robotic. We all know the success of TK depends on proper limb alignment, accurate component placement, and precise ligament balancing. We have published an article recently in 2021 which states that the overall limb alignment with the help of all Burr can be within 1.2 degree. Whatever philosophy you believe, kinematic, restricted kinematic, functional, or mechanical, you can get everything with robotics within a range of 1.2 degree, and the component malposition is also less than 1 degree in both coronal and sagittal plane. But we all know that femoral rotation also plays a very important role for normal patella tracking as well as for flexion gap balance. Hence, to have proper knee kinematics, the femoral rotation plays very pivotal role. So when you get a rectangular gap, you are happy because your patient will be happy, but how much external rotation we want is still a big question. Lot of techniques have been described in literature where we use in conventional method like spacer block, tension jigs, lamina spreader, anatomical landmarks, white side line, posterior condylar, transepicondylar, navigation, patient specific. This itself speaks we are not yet reached what is best to get external rotation of the femur. In this recent article in Journal of Arthroplasty says that if you follow 3 degree of external rotation, you are tend to be around 50% error with surgical epicondylar axis. So 3 degree should not be the norm. This is what the paper says in 2021. Way back in 2007 also, it was saying that with conventional, you have internal rotation of around 3.3 degree to 5 degree external rotation. Navigation also have that deviation from 4.7 degree internal rotation to 2.2 degree. Navigation has helped to improve that rotation, but the mean deviation was also too much. We all know that mal-rotation of femoral component will have patella subluxations, patella wear, instability, dissatisfied patient, and that unexplained post-op pain. So, with all this in my mind, the aim of our study was to assess the precision of femoral component external rotation with all Burr TK. It is a prospective study of 30 patients where we have included primary and secondary osteoarthritis of the knee. Exclusion were revision and partial knee replacement. All procedures were done with Navio all-Burr robotic TK performed by single surgeon. Post-operative CT scans were done in all 30 patients to assess the external rotation as per our intraoperative planning. Philips 128 slice detector metal subtraction reduction was done within 6 weeks of the surgery, and all the CT measurements were done by 2 radiologists who were unaware of the intraoperative findings. So this is what I keep it 0 degree to my posterior condylar axis because I don't want it 3 degree for all my patients. So once you have done your surface mapping and the stress x-rays, you get this kind of map where you see their flexion medially is tight and laterally is lax with 0 degree of rotation. So how you plan your rotation, it depends on your soft tissue balance, and the rotation should be within limits. It can't be 10 degree or 15 degree. So here I know that I'm little tight in flexion, so I'll plan accordingly and converted my external rotation to 4 degree where I have balanced my lateral gap both in extension and flexion. But I'm still tight in medially both sides because I know when I'm going to remove that much of bone, up to 2 millimeter, the ligaments and soft tissue get released. But if you have significant osteophytes posterior medially on femur and tibia, this tightness may be up to 4 to 5 millimeters because we know that much of the ligament will and soft tissue will get released. And then you perform with all Burr robotic TK, and you can easily take out the posterior as well as all aspect of the bone with all Burr within a minute or 2. And then you see how the ligament got balanced very well right from 0 to 90 degree, and this tightness has also become lax to say 0.5 millimeter without much releases of the soft tissue done. So out of 30 patients, 13% had 1 degree external rotation, 2 degree was there in 23%, only 37% of patients had 3 degree external rotation, 4 degree was there in 17%, and 5 degree external rotation was there in 10% of patients. So now, was it replicated in post-operative? So all patients underwent CT scan. The most axial cut was taken and the line passing through the most distal part of the metal called as femoral prosthesis posterior condylar axis was marked, and then the radiological transepicondylar axis was marked, which is from lateral epicondyle to the medial sulcus, and the distance between the two was calculated as the external rotation of the femur. So there was a very strong correlation between the planned and the external rotation, and what we achieved on the CT scan. The minimum was 1, maximum was 5, and what we achieved was 1.25 and 5.5. So there was a very strong positive correlation. Other important finding of our paper was none of the femoral component was in internal rotation. Again, the same slide, I want to emphasize that 3 degree was only required in 37% of patients, and the mean deviation was 0.24, minus 242 plus minus 28. And once you achieve that, you have quite a stable knee, both in flexion and extension, and a good patella tracking throughout the range of motion. And when you have that kind of balanced knee with whatever philosophy of alignment you believe, patients tend to recover very fast when they are in your hospital itself doing all activities within a couple of days. And when they go home, they have quite a comfortable walk and no instability complaints even before suture removal. Same another case, a 82-year-old gentleman with severe varus, unable to walk without support, and this Navio robotic all-bar made him get rid of that walker and quite stable within 3 weeks of the surgery. The limitation of our study was it's a small group of patients and we have not done any functional outcome. But the conclusion was that all-bar robotic provides accurate femoral component external rotation and plan with deviation to around 0.3 degree from whatever you plan. So alignment philosophy you can plan with less deviation, component placement also with less deviation. Hence, all-bar robotic will help you to get that precise component placement in all 3 axes as well as a correct alignment as per your philosophy. Thank you.